PCRT16-001 was a phase 2 study of PEGPH2O plus Pembrolizumab for patients with hyaluronan or HA high refractory metastatic pancreatic ductal adenocarcinoma. So the basis for this study is that we know that stromal hyaluronan or HA can serve as a physical barrier and protects pancreatic cancer tumor cells from immune surveillance. And we do know from preclinical data that PEGPH2O has demonstrated to increase infiltration of cytotoxic T-cells and potentially improves delivery of PD-1 and PD-L1 antibodies, which we all know to date has not been effective in pancreatic cancer. And so based on this rationale, we hypothesized that stroma remodeling with PEGPH2O could sensitize pancreatic cancer patients to immunotherapy. And so we enrolled patients with histologically proven metastatic pancreatic ductal adenocarcinoma who've received prior treatment, up to 2 prior treatments. Patients had to have confirmed HA high status by a central Ventana assay, and patients had to be willing to undergo pre-treatment and on-treatment biopsies if deemed safe for translational analyses. And in terms of the study design, patients received PEGPH2O once a week for 3 weeks in a row and 1 week off. And Pembrolizumab was given on day 1, and these were administered on 28-day cycles. All of the patients on study were required to receive prophylactic enoxaparin. As we know that PEGPH2O does increase the risk of venous thromboembolism. And also patients were given NSAIDs, given one of the main side effects from PEGPH2O is musculoskeletal side effects. So the primary endpoint of the study was looking at progression-free survival, with secondary endpoints being safety, overall survival, objective response rate, and also the rates of stable disease. And then we also had planned translational endpoints, including immunophenotyping, TCR receptor clonality, flow cytometry, as well as looking at circulating cytokines, as well as circulating and tumor HA expression. So our planned analysis was to look at improvement in progression-free survival from baseline historical data of 3 months to 6 months. And so that required 35 patients to be enrolled onto the study. And from May of 2019 to November 2019, we enrolled 38 patients we screened 38 patients for HA expression. 8 of those patients were deemed eligible and enrolled. Unfortunately, because of the negative data of HALO 301 study, which was a phase 3 study looking at the combination of gemcitabine and nab-paclitaxel alone versus gemcitabine, nab-paclitaxel, PEGPH2O, was a negative study. This trial, unfortunately, had to closed early. And so we stopped the analysis after the 8 patients were enrolled. So of the 8 patients that were enrolled, the majority were male, median age was 68 years, majority were Caucasian, and these were heavily pretreated patients with median number of lines of therapy being 2, with ranging from 1 to 4 prior therapies. So in terms of the outcome of this study, we did not detect an improvement in PFS compared to the historical data. So in our study, we noted a progression-free survival of 1.5 months. However, most notable here is that we did notice a fairly decent overall survival compared to historical outcomes with a median of 7.2 months. And I want to make note that we actually had 4 patients who had a prolonged overall survival of greater than 300 days, with actually 1 patient at the time of data cutoff of 538-day plus. In terms of responses, 2 patients achieved stable disease. We did not observe any objective responses on the study. The median duration was 2.2 and 9 months. And again, the main reason for study discontinuation here was disease progression, but we also had 3 patients that terminated study due to the study closing early. In terms of treatment-related adverse events, main side effects were myalgias and muscle cramps, which were overall pretty manageable and grade 1 mainly. And then we had a few immune-related adverse events being hypothyroidism and as well as dyspnea, but again, very mild and manageable. In terms of translational analysis, which are still very preliminary and ongoing, we did note some unique molecular alterations in 2 of our patients, particularly those who had prolonged overall survival greater than 300 days, including 1 patient having a RET fusion and another patient having amplifications in FGFR1. And these are notable because these are also potentially actionable mutations with currently available targeted therapies. Our preliminary analysis did not show any significant difference in CD8 positive T-cell infiltration or PD-L1 expression with overall survival or best overall response, but we're anxiously awaiting further analyses that we're conducting, including the TCR analysis, circulating cytokine analysis, as well as other biomarker analyses. So in conclusion, we did not note an improvement with the combination of pembrolizumab and PEGPH2O, but again, because of the encouraging median overall survival of 7.2 months in a very heavily pretreated microsatellite stable pancreatic cancer population. There is some suggestion that this therapy might have served as some priming for future therapies. And so it's even more important, I think, from this work for the translational analyses to be conducted, which we'll hopefully report soon. And that will give us insights about how we can better design future trials looking at immune microenvironment and as well as immune checkpoint inhibitor therapy.